Hello everyone, welcome to Clean Hospitals. Clean Hospitals was created in 2018. Clean Hospital is a group of academics, industry, scientists. We work together to make sure that hospitals are safer all over the world. So let me ask Pierre to tell you about our activities. Pierre is clearly a member of the board of Clean Hospitals.
Thanks, Didier. Hello, everybody. A lot have been achieved since the launching of Clean Hospital project. First, we need to advertise and promote and create awareness around healthcare associated environmental hygiene. Obviously, we started with science and the basic fact, and we perform a scientific systematic review of all the evidence about interventions that are efficient in this field. After that, we have a lot of communication and innovative initiative. We created the Healthcare Cleaning Forum inside the huge and big Interclean event in Amsterdam. It's only example. Obviously, we also added a Clean Hospital Day each 20th of October, and this event is rising year after year, gathering more and more people on social media. Obviously, on scientific part, we have created an healthcare a self-assessment framework around environmental hygiene. This framework has been initiated on the basis of those has been performed by Didier and Wu on hygiene. The field of environmental hygiene is wider, but the spirit is the same. And now we are really happy to launch it around the Clean Hospital Day. Obviously, we have also gathering a panel of experts during the period of time with the purpose of working on the most burning topic, what we should do in the future in the field of research or changing guidelines, and also working of recommendation in the field of assessing what should be a cleaner or how it should be trained. For the last part, we have also in our heart the field of sustainability, which is really important. We are working with our partners, the companies on that field to make product more sustainable, and we have that in the perspective on the next years.
Thank you, Pierre. Fantastic. So as you understood, we started in 2018. We are in 2023, and all these progresses were made. And at ICPIC in 2023, we had a Clean Hospitals Symposium, Clean Hospital booths, and now you will have the privilege to listen to the 4 lecturers that gave their lecture at ICPIC 2023, and they are all 4 members of our international group of experts. So enjoy the talks, enjoy the video.
We have great data demonstrating that if we improve the cleaning and disinfection of our hospitals, we can reduce pathogen transmission and prevent healthcare-associated infections. Unfortunately, we also have data demonstrating that most, and probably all of us, have opportunity to improve the cleaning and disinfection in our hospitals. So as we move on this journey towards cleaner hospitals, it's really important for us to step back and review our current policies and protocols, our materials and supplies, and our current level of performance when it comes to cleaning our hospitals. And this may help us understand where the gaps exist between evidence-based best practice and what's actually happening in our hospitals. Once we understand what these gaps are, it's important to understand why those gaps exist. Are we lacking supplies? Are we lacking technical training or competency assessment? Or are there more socio-adaptive approaches that we need to take to help reduce those gaps so that we can provide clean and safe hospitals? Once we identify what those are, it's important for us to identify interventions to correct those deficits. This might include technical training, assessing the competency of cleaning personnel, or perhaps providing socio-adaptive skills and techniques to help people overcome the barriers and challenges that they encounter when they try to put those technical skills into place in real hospital settings. And we know from previous research that by doing that, we can dramatically improve the cleanliness of our hospitals. But we also know that we can't just do this one time and move on and forget about it. If we don't continue to address these issues, assess our current practices, and provide feedback about current practice to our frontline staff and their supervisors, we'll lose those improvements that we initially gained. So we need to continue to assess, provide feedback, and identify new opportunities and challenges developed. And by doing so, we can make our hospitals even safer for patients.
Congratulations, Clean Hospital. My name is Yusuke Saraya, the global CEO of Saraya Company. Well, we get through the COVID. This is good. We are working to prevent AMR, antimicrobial resistance. Now, we promote hand washing and dispensers, new dispensers, yes. Medical device reprocessing, yes. Personal protection equipment, yes. Then we clean environment of the hospital, yes. Then we will serve you through our global network, 35 countries of sales office and factories around the world. So let's work together for Clean Hospital. Thank you very much.
I'm really excited to announce the launch of the Healthcare Environmental Hygiene Self-Assessment Framework. It's an online tool, and it's meant to for healthcare facilities to be able to benchmark against themselves and identify gaps and weaknesses in their environmental hygiene programs. This self-assessment framework, or HESAF as we call it, it follows in the footsteps of other major self-assessment frameworks that are currently distributed by WHO. So the hand hygiene self-assessment framework that was also developed in Geneva, and the IPC self-assessment framework from WHO. It was started about 4 years ago, and it's constructed around the multimodal improvement strategy, which is an implementation strategy for behavior change, which includes system change, so access to products and supplies, training and education, monitoring and feedback, workplace reminders, and institutional safety climate. So the self-assessment framework really looks at all of those different elements across all the different fields of environmental hygiene, which include surface cleaning and disinfection, laundry, air control, water control, waste management, and sterilization and device reprocessing. To tell you a little bit more about how that self-assessment framework was developed, we did a pilot study of an early version that was published in 2022, where we looked at 51 healthcare facilities in 35 countries around the world from all of the different income levels as defined by the World Bank. Our biggest takeaway from that was that 98% of healthcare facilities were majorly lacking in one of the components of the multimodal strategy. Some of the results that we had were truly shocking, and globally, the level of environmental hygiene around the world is very low. So what we're attempting to do with the self-assessment, which is of course just a first step in a long process of improvement, what we're hoping to do is that healthcare institutions around the world can access this, and in a secure way, we don't share any identifying data with anyone else, and that they can identify those areas for improvement and then possible tools for how to increase their environmental hygiene and increase patient safety. The tool is currently only online on the Clean Hospitals website in English, but we have 7 other languages that it has been translated into. So currently it's available in Chinese, Croatian, French, Portuguese, Spanish, and Turkish. We look forward to putting those online and for you to be able to access them in the near future.
One moment, one decision, one life. This is the headline of our campaign, where we are focusing on the terms and the topics that Clean Hospital is just focusing on. Hand disinfection, surface disinfection and cleaning, and also instruments reprocessing, like in the CSSD and in endoscopy, and also for air issues that we see in the healthcare environment. This is one of our concepts where we want to provide the customer with some solutions, but as a concept. And the main concept there is really not to focusing on products, it's to focusing on the solutions for the customer with training and with concepts. And this is something that Clean Hospital also has in mind and also is following. And this is something we really want to support from B. Braun. Staying on the level of consultancy and using such institutions like our Escalab Academy, where we provide training and education to get the customers there on the level they want to achieve and to provide them with perfect solutions and concepts for their demand. B. Braun is also offering the Hand Hygiene Excellence Award, a program that is open to global customers located in Latin America, in Europe, or in Asia Pacific, Middle East, Africa. This program is according to the WHO self-assessment framework for hand hygiene, where you have your skills and your performance gaps. And this is also part of a program where we help the customers to fulfill this self-assessment framework. A part of the services from B. Braun is also the Escalab Academy. The Escalab Academy is located in many countries all over the globe, Asia Pacific, Latin America, and Europe.
I was thinking about how we communicate our ideas and the importance of our ideas around healthcare environmental hygiene. If we don't choose our words carefully, there's a really big risk that the key messages that we have and the importance of those messages will be lost in translation. We'll end up speaking a different language and just not understanding one another, not connecting. Some work been done around antimicrobial resistance that shows that messages begin to land with people when they're personal to them. Things about the world or our world are nowhere near as impactful as things about my world. For example, when we start to talk with people about the personal impact of antimicrobial resistance, like you might get a resistant infection and we can't treat it as well, their ears prick up and they really begin to listen to what we're trying to say. When it comes to hospital environmental hygiene, there's some really compelling data that it's important, and if we get it wrong, there's direct impact on patients. There's some fascinating data that shows that if you're admitted to a room where the previous occupant of that same room has a certain pathogen, be it MRSA or VRE or C. diff, then you, as an incoming occupant of that room, have an increased risk of acquiring those pathogens based on the status of the prior room occupant. And that shows us that we're not always doing an adequate job of hospital environmental hygiene in the terminal cleaning and disinfection between those patients. And that's resulting in an increased risk for the next occupant of the room. Put another way, we know from research that's been done and published over many years that if we improve standards of environmental hygiene, then we get better patient outcomes. And we can see this in the prior room occupant, whereby if we do a better job of terminal disinfection, then that increased risk from the prior room occupant goes away. And the incoming occupant is no longer at an increased risk because we've got rid of that residual contamination. When we're thinking about hospital environmental hygiene, we need to think really clearly about cost and value. I think there's a tendency towards making cost savings in the world of environmental hygiene. And the main reason for that is the impact of it and the patient safety risks that it introduces are not immediate. So it takes time, weeks, months, even years for a big reduction in hospital environmental hygiene to result in patient safety risks, more infections. And so it can be seen as an easy win in a financial sense, but actually for patient safety it's not good. So we need to look at the literature, formulate our arguments really carefully so that we can talk to the value of hospital environmental hygiene and not just the cost. We've got some brilliant data now from a cost effectiveness perspective that shows that investment in hospital environmental hygiene is worthwhile. Putting an extra cleaner on a ward, or implementing a new training program, or evaluating and implementing new technology to help us reach higher standards of environmental hygiene. All of these things, whilst they may not save money directly, they are cost effective and they are worth the investment. Hospital environmental hygiene, as you can tell, is a passion of mine. It's something that's really important. It has direct patient safety benefits if we get it right, but it does require investment of time and resource to make sure we have adequate infrastructure to deliver effective hospital environmental hygiene. Thank you.
We are a 100% Guatemalan company that implements efficient solutions to reduce the number of nosocomial infections and cross-contamination through disinfection on surfaces. We have successfully implemented in the hospital environment the control, monitoring, and management program for the reduction of microbial load through the use of saturated dry steam technology. The saturated dry steam is generated through natural minerals present in the water, which serves as a conduit to convert temperature into energy and promote a term shock on all types of microorganisms found on surfaces. The use of steam technology is ideal for countries with limited financial resources and in the process of developing, since it is a method that allows the revitalization of surfaces, elimination of organic matter, reduction of microbial load, and elimination of biofilms in the same process. We are an active part of Clean Hospitals.
So my interest really is in how infection control policy and practice may be driving unsustainable practices in terms of environmental harms and in terms of labour rights issues. It's something I've actually called yellow washing. It's where there is a misconception about infection control that drives us in particular to throw things away. So what does that mean in practice? Well, it means that we've moved from historically where a lot of products that we were using were reusable to where they're disposable. Our own data show, for example, in the 5 most common operations performed in the UK, the carbon footprint of the products used, 68% of that carbon footprint on average was due to disposable products. So disposable products are contributing to the carbon cost, if you like, to our planet, as well as our continued use of other resources through this throwaway culture. The problem is it's not just the carbon that's generated, it's also some labour issues. So I'm going to perhaps just summarise some examples of this. I suppose the exemplar is the use of gloves, where we know certainly in the UK data shows 60% of glove use is inappropriate. And that's driven perhaps by behaviours and cultures of practice, both institutionally and personally, where we'll use gloves where they're not required. What we found out is that gloves contribute a huge amount. In the NHS, prior to the pandemic of COVID-19, there was 1.7 billion gloves used just in England alone, all thrown away with a carbon footprint equivalent to driving more than 8,000 times around the planet in a petrol car, enough plastic to almost stretch to the moon. And most of that is inappropriate. That's one example, but linked to that, we found labour abuses in the supply chain. So this forced labour is endemic in gloves factories in Malaysia, the largest area of production of gloves, with workers paying ridiculous recruitment fees, being forced to work for up to 3 years and living in terrible accommodation with severe mental health issues. Other examples, we find hospital textiles. The vast majority in the UK are disposable, and indeed across Europe, for no reason, because we know that reusable textiles actually are better quality, have lower infection risk. But we've generated these cultures of disposal. We know that, for example, some textiles are produced also under bad working conditions, with some disposable gowns being made in China using forced labour from North Korea, where between 70 and 100% of the salaries were sent to the North Korean state. What other examples? Metal instruments. We throw those away as well in some circumstances. For example, in accident emergency in the UK, in other outpatient settings, we throw those metal instruments away. We throw laryngoscope blades away as well. 3 million of those every year in England because of potential risks of something like CJD, which actually just doesn't seem to exist. And the result of that, we have not only the carbon, but again, labour abuse, because we know that 70% of the world's surgical instruments, particularly the disposable ones, are produced in Pakistan using sweatshop labour and child labour, with children as young as 7 working on grinding wheels to make these things that we just want to throw away. So we need to bring sense and sensibility to this, and we really need infection control expertise to say, no, this is something that we can reuse and we should reuse, and that is actually going to help us both to protect our resilience in our health systems. We're finding it's reducing cost. More importantly, it's going to save our planet, or contribute to that rather, and it's going to protect workers from harm.
At Acara, we've really benefited from our membership in Clean Hospitals. I think the main thing initially was, the reason we joined was getting access to some of the top experts in environmental hygiene in the world. And as a technology developer, first and foremost, understanding what the key science was and the key research was, and having them actually inform our process was a huge benefit. I think the second big benefit has actually been the opportunity to get hands-on and actually visiting hospitals. We've had the opportunity to spend time in Geneva in the University Hospital there, where we've understood exactly how a really top global hospital works from infection control. So we've been able to map how our technology works from a technology standpoint to see how it would work in practice once it gets rolled out. And then the final benefit has been the opportunity to get to know other companies, because ultimately our technology exists alongside others, and by being able to understand their perspectives and their experiences, we're not only learning about the hospital's system more broadly, but we're seeing new ways in which we can partner with and collaborate with other people in the ecosystem.
As a member of Clean Hospital Initiative, our mission is clear: to combat infections, help with combat the antimicrobial resistance, and in all the things preserve the environment. We are all gathered now, industry, academia and hospitals, and we are here to raise awareness of the crucial role that hospital hygiene plays for public health. Being a producer of UVC contactless disinfection, we're trying to do our best to offer a solution that helps this major role of this great organization. We are proud to be a member of Clean Hospital Initiative, keeping the hospital cleanliness level at its maximum.
Since its formation in 2018, Clean Hospitals has become a powerhouse, this international institutional centre for public health. And Diversity have been very proud to be part of this organisation since the very beginning. And that's because Diversity has been around for over 100 years, and we believe in going beyond clean. And Clean Hospitals allows us to do that. We're able to bring our expertise, our knowledge, our research to the table, and we're very privileged to be able to work with an incredible set of academics. And together we can tackle some of the issues that urgently need to be addressed now. Issues like healthcare-associated infections, AMR, pandemic readiness, sustainability. I believe that we have the right team in Clean Hospitals to tackle these issues. And if you think your organisation can contribute, then please do join Clean Hospitals today.
Hi, my name is Jo Cly, and I'm an Infection Prevention Fellow with Clorox Healthcare, and we are proud to be a sponsor of the Clean Hospitals Initiative. By working together, we can help raise awareness on the importance of a clean and sanitary healthcare environment. And through the provision of education and tools, we can make healthcare facilities safer by eliminating the environment as a source of infection.
Pacto Ambiental ha encontrado en Clean Hospitals un aliado para poder estudiar, adoptar y replicar metodologías que den óptimos resultados en las tareas de limpieza y desinfección de superficies, para evitar la contaminación cruzada y reducir el índice de infecciones asociadas a la atención de salud. Es de suma importancia contar con el apoyo y respaldo de Clean Hospitals, quienes constantemente, junto a sus equipos multidisciplinarios y socios, estamos intercambiando información relevante de las mejores prácticas en higiene ambiental, que permita reducir la resistencia a los antimicrobianos y hacer que los hospitales sean más seguros.
Here you are, you were almost part of this symposium, the Clean Hospitals Symposium at ICPIC 2023, with these 4 outstanding speakers that Pierre and myself had the opportunity to introduce and also to challenge. So it was a real pleasure for all of us, and I hope you enjoy. Now, what about the perspectives of the Clean Hospitals Initiative? Pierre?
Thanks, Didier, and it was really a fantastic session this year. The perspectives are first to use the framework throughout the world. For us, it's very important to assess the situation in every healthcare setting. Throughout the world, whatever the means are, you can improve your quality, you can do things, and the framework could help you to do that. It will provide us data on what is ongoing throughout the world in this field and what are the means to increase the quality in this field. So obviously you have behavior change and many things, and for us it's the main purpose. The self-assessment framework is in English first, but it will be provided in several languages throughout the world to help its use throughout the world. So for us it's very important. After that, everything will be connected to that. The awareness is still needed and we will fight for that. For us, the purpose is to provide a safer environment to patients. Yeah, when you're patients in hospitals, you should feel confident about the quality of the environment and the fact that it's free of pathogenic microorganisms. So it's a fight, and we will do many things to reach it.
And we can say also, Pierre, that this framework is inviting to more fine-tuned scoring systems in different area and domains that we will develop. And our experts, panel of experts, provided to us many ideas so that we know we will be busy for the coming years. So remember the Clean Hands initiative that we started. The Clean Hospitals model is actually modeled on the Clean Hands initiative that we launched in like 2009 that we were working together. And we hope that the success of the Clean Hospitals model will actually move toward the direction of the Clean Hands models that is now reaching all over the world. So an exciting future.
Yes, obviously, and you can help us to make the success of this project.
Absolutely. Thank you, and looking forward to all of you participating in this project.